All right. So for some of these questions, we're going to do, we're going to follow the same principles that we followed for what we did up here with the medications, where I introduced or reintroduced or talked to you about what's called the order over have, or order over available. So you look at what it says. So it says you have Aldamet as labeled below. Here's your label. You're ordered Aldamet 400 milligrams PO, which means per oral or by mouth, TID, so 3 times a day. How much medication will the patient receive in one dose? So first thing you got to look at is, okay, so it's by mouth. So by mouth means it can be liquid. So that could be answered in milliliters, or it could be in tablets. So based off of the question, we don't really know how this is going to be received until we look at the label. And you notice the label will tell you it's an oral suspension. It's already listed in milliliters. So you can see where it says 473 milliliters is your oral suspension. That tells you right off the bat that your order is going to be in, or that this is going to be a liquid medication, and that it's in milliliters. So that just kind of helps eliminate the guesswork as to what you would put. So you wouldn't put tablets here because nowhere on the label does it say anything about tablets. The next thing we have to look at, so 473 milliliters, that's the total volume of this Aldamet that's available. We want to know what the concentration is. And that's where you can see in the shaded area here where it says 250 milligrams per 5 ml. That is what you have available, and that is also your quantity. So what I'm going to do is I'm going to show you how I would set up a problem like this using both dimensional analysis and the order over have format. So let me switch over here. All right, so my order is the 400 milligrams. My available is 250 milligrams. And then the quantity is going to be the 5 milliliters. Now, sometimes you'll write available as 250 per 250 milligrams per 5 ml. For showing you the, just to kind of break it down, maybe unnecessarily, for the order over available times quantity formula, this is why I'm doing it this way. And then I'll show you the other way using dimensional analysis. So what's my order? 400 milligrams. What do I have available in milligrams? 250 milligrams. And what is my quantity? That's the 5 milliliters. So what I'm going to do is I'm going to take my calculator. I'm going to do 400 times 5, which is 2,000, divided by 250, and that gives me 8 milliliters. So how much would I administer for this medication? I would administer 8 milliliters. If I were doing this dimensional analysis, I personally like to start with the order still. Then I multiply by my conversion. So when we deal with suspensions and oral suspensions, you're always looking for your milligrams per milliliter, because that tells you the concentration or the strength. And so I'm looking to get rid of milligrams, and I want milliliters. And then I just plug in the numbers: 5 milliliters, 250 milligrams, and I'm going to get the same answer. The 8 milliliters is what you would administer for this Aldamet solution. So in the Allegheny OneDrive folder, there are a few other practice problems like the Aldamet that I just did. There's Demerol, and you can see that it's available in 50 milligrams per milliliter. There is another mepridine, which looks, is it the same? Oh yeah, mepridine and I'm assuming Demerol are the same thing. Looks like the question is repeated. Here's a heparin solution. So this is one, this is a Tubex one. We're going to solve this and then we're going to practice marking a syringe. Try to at least. It's going to say try to because it's hard for me sometimes to write out my write neatly with my mouse or mark neatly with my mouse. So for this, we look at a couple things. We look at what the order is. The order is heparin 4,000 units SC. So if you ever see SC, which means subcutaneously, or IM, intramuscularly, you know, even if it doesn't tell you, that it's milliliters, okay? It has to be. It's a liquid. It's injected. You're not injecting powders. You're not injecting tablets. You're injecting a liquid, okay? Now, this tells us to mark the Tubex. I think you're going to be marking syringes more so on your test than the Tubex, but I'll show you how to mark this as well as how to mark the syringe. So my order for this is the 4,000 units. My available, and I didn't even show you that, I apologize. So let me go back to that. My available, when we look at the actual label here, you see where it says 10,000 USP units per milliliter. And it also tells you for subcutaneous or intravenous use. So you wouldn't want to use, if the label said or the order said intramuscular, you might want to question whether or not that order is valid. So I don't think you're going to see questions like that where like either testing you on reading that from the standpoint of the dosage calculation test. But if you see that on like an NCLEX or an ATI, that can be a reason why you might miss a problem here or there because you are, they want you to do something beyond just answering the math. They want to make sure that you're paying attention and seeing on the label, it says what the directions are for. And if you're trying to use it off label, for lack of a better term, then you need to make sure that that's, that it is accurate and okay. All right, so the available is the 10,000 units. And the quantity is 1 milliliter. And so if I'm doing order over half, 4,000 over 10,000, these are units, times the 1 milliliter. Now, if you ever get hesitant about plugging these types of big numbers into your calculator and you're afraid you're going to put one too many or one too few zeros, one thing you can do, and this is just something to practice, look at the number of zeros. And I have 3 zeros here. I have 4 zeros here. I can mark out 3 zeros as long as I can also mark out 3 zeros. So 4 over 10 is much easier to put into your calculator than is 4,000 over 10,000. So just something to keep in mind. You don't have to do it that way. I'm adding in another hopefully it's helpful portion there. And so my answer here would be 0.4 milliliters. All right. So going back to the Tubex here, with the Tubex, we are going to be marking the 0.4 milliliters. And so one of the things you want to pay attention to is what each of these things represent. So if this is the half milliliter, that tells you it's 0.5. The other thing we want to make sure is, are these in tenths? Are these in 2/10? Like, what are these in? So I'm going to say 0.5. Then I'm going to bounce over here, 0.6, 0.7, 0.8, 0.9, 1.0. Okay, so we know that they're in that order. So if I'm marking the Tubex, I'm marking at the 0.4 milliliter mark. If it tells you to shade it in, then you probably want to, better than I'm doing it, shade in up to the 0.4. And then if you want to make sure, you're not making a mistake, just also, maybe indicate or write that you are using the 0.4 milliliter mark. Sometimes my writing seems to be okay. Okay, so that's supposed to be an arrow here. So I apologize if this is 0.4, not 10.4, 0.4 milliliters. So that's how you would mark that or shade that in. Now on your syringe, if we were marking 0.4, we have to first make sure, can we do that? So I'm going to blow up this image here. And so I need to make sure. So this is 0.5. So this should be 0.6, 0.7, 0.8, 0.9, 1.0. Good. So I can mark that. Now let's just say the answer was actually going to be 1.3. Okay. So if I'm going to mark, and I just chose that arbitrarily. Okay. So don't get hung up on all that. Let's just say we're marking, we got to an answer and it was 1.3 milliliters. This will just help it so it looks easier. It usually says it usually tells you to shade it in. So here's 1.1, 1.2, 1.1, 1.2, 1.3 is right here. So we're going to shade in everything here. Okay. And you're going to shade that in better than I am. Okay. I can only do so much, but you're going to shade in from 0 to 1.3 and make it definitively look like you are shading that in appropriately. Okay. So between 0 and 1.3, you want to be shading that in. And again, do a better job than I am. I'm trying to do that with a mouse. I think I did okay. Okay. I think sometimes the challenging part is just making sure, you can get to the calculations, but with some practice, you can find out if that's a problem for you or not. So I'm going to give you some leeway to practice a little bit more with those. And then if you run into issues, you can let me know when we get together on Thursday. All right. So the next thing, and again, this is kind of like, this falls into the whole just kind of procedural. It's not so much a matter of math necessarily at this point. It's just, can you follow directions? Can you read what's called a sliding scale? Sliding scale is usually done within a hospital setting, or is done within a hospital setting. And basically you're taking the patient's blood sugar at certain times of the day and then determining how much insulin that they would require. So it says the client's blood sugar at noon was 315. How much insulin should be administered? And so what we're going to do is we're going to look at our sliding scale. And I'm going to get my annotation out here. And we're going to look for where 315 falls. So 315 is going to fall in this range right here. And so the answer is you would administer 8 units. Now that kind of looks like a funky G or snowman of some sort, but it's supposed to be the number 8. So you're going to administer 8 units. Make sure you write units in your answer. Do not leave that off. Then it'll tell you to shade the dose. So what we're going to do is we're going to look at this and we're going to see, okay, I see 5, 10, 15, 20. So I should see little tick marks. So that should be 6, 7, 8, 9, 10. Good. We're all good with that. So I'm just going to go to, we said 8 units. So 5, 6, 7, 8. And I'm going to shade in the 8 units. And again, you'll be able to do this easier on a paper test than what I'm trying to do here on that. So they just want to make sure that you can read and mark a syringe as well as follow directions. So if you had like a like 400 or greater, or if you had less than 70, then you need to call the MD and verify how they want you to proceed. Okay. All right. So I don't have more yet of that. Now I do want to share one more thing with you, just to kind of talk about, and then I didn't put any practice together for this yet, but I'm going to, so I do apologize. But the next thing that we're going to be talking about are what are known as the reconstitution questions. And these can be challenging, and mainly it's just because you've never seen it before. And so I'm going to show you how to navigate these types of questions. Let me just see if I have what I'm looking for. That's not what I'm looking for. This might be it. All right. This will work. All right, so I'm going to share this. What I'm doing right now is I pulled up I just did a Google search for reconstitution labels. Okay, so you're going to see something, and it's going to be worded very similar to some of the questions that we had before, where it's going to say something like, the doctor orders so many milligrams of Zithromax via IM, intramuscular injection. Okay, and then it'll tell you to calculate how much you would give in one dose. Okay, and then you're going to see this, and you're going to see it says it's for IV infusion. So IV tells you that it is a it's going to be a liquid medication. So you would give this to the person, or that your units are going to be milliliters for this because it's IV. You don't put powder into the IV system. Okay, I'm assuming you know that. But unlike the previous labels that we looked at before, you'll notice that it just says 500 milligrams. It doesn't say anything about volume on this. And so we have to do a little bit of searching. And that's kind of the challenge with what are called reconstitution problems. And we'll do some more of these, because I'll create some more practice problems for you guys on Thursday. But for the reconstitution, we have to look on the label itself, and it says constitute to 100 milligrams per milliliter. That's actually what we're looking for, is the strength. And in order to do that, you're going to add 4.8 milliliters of sterile water for the injection. And you might be wondering, when did we do this? Well, this is usually done in the pharmacy, but you might have to do this also if it's, in certain, obviously, clinical settings. You might have everything there that you need to add water, shake, and then administer. So it tells you right here, constitute, which is the whole purpose of a reconstitution, 100 milligrams per milliliter. So this Zithromax is a powder. We're going to add water, and then we're going to make a concentration of 100 milligrams per milliliter. So let's say I'm supposed to administer 250 milligrams via IV. Now I know that my concentration is the 100 milligrams per milliliter. So let me just see if I can create some space here. Okay. All right. So what I'm going to do is I'm just going to kind of write on the label here. So this is the information we need in order to solve this problem. And notice that it's off on the side of the label. You don't need to worry about the 4.8 milliliters. It's just helpful to know that that's what they added to the powder to get to the 100 milligrams per milliliter. So if it's 250 milligrams is your order, you would just do 250 over 100 times the 1 milliliter. And then you would get an answer of 2.5 milliliters. And again, if you needed to mark that on a syringe, I think you can do that now. And then all I did here was the order over half. I took the 250 milligrams. I know I didn't indicate my units, but like I said, it's hard enough to draw on here. Okay, 250 milligrams over 100 milligrams times the 1 milliliter, and then you get your 2.5 milliliters. So that's what I wanted to show for today. And on Thursday, I'm going to, or at least between now and Thursday, I'm going to try and post up a few extra practice problems. Any questions?
So just so I understand clear, anytime it says the reconstitution amount, that's what we're always going to go by for the for powder for reconstitution drugs, correct?
Say that one more time. I'm sorry, you cut out.
I'm sorry, my son's here. You said the constitution amount, like for this one, is 100 milligrams on it. So anytime we see a constitution and then the amount, that's what we go by. We don't go by anything else on here.
Correct. Right. So, and the reason being is because this is 500 milligrams, but of what? Is it 500 milligrams of tablets? Is it 500 milligrams per milliliter? We don't actually know that until we look at the label. And that's what makes the reconstitution kind of tricky, a little bit different. Let me see if I have another example. Sometimes it's helpful to see it in a couple different ways.
Because I remember doing some questions on ATI and it had the reconstitution amount, but it wasn't asking for that because of how it was being given. So I guess, yeah, I just was wondering on the actual dosing test, are they going to have like trick questions like that or?
So, and that's the thing. It's not supposed to be a trick, but so yes, you will have questions like this, where it'll say like, so let me look at the wording here. I mean, it'll still say like for, you have, whatever the medication is as labeled, the order is whatever it is, how much medication will the patient receive in one dose, but then you need to know like how to get that information off of this. So like for this ampicillin, it's a 1 gram ampicillin and it's 4 injections, but it doesn't tell you anything as far on the main big part of the label. It doesn't tell you if it's for an injection, you need to know the milliliters, but it doesn't say anything about milliliters here. So we have to look down here and it tells you to add 3.5 milliliters diluent. And then what that gives you is a solution strength. And that's what you're looking for, is you're looking for the solution strength of 250 milligrams per milliliter. And that's essentially what you're looking for, is you're looking for that milligrams per milliliter concentration. That way, you know what it is. The 1 gram, that doesn't really tell you anything. Adding 3.5 milliliters doesn't really tell you anything. You need to know what the concentration is after the water is added. And it is clearly on the label. You just need to know how and where to look for it and why you're looking for it, I guess.
All right, thank you.
Yeah, you're welcome. So that's kind of where, that's what I wanted to cover today. Do you have any other questions or?
No, I think I'm pretty good. I just got to look at more labels to, get them down.
And I'm going to keep adding. I think I did add a few of these labels in the overall practice, practice folder for all the nursing sections. Okay, good. Yeah, so you can look at some of them that I found. And all I did was a Google search for the reconstitution questions, Google search for labels, just so you can get an idea of practicing what they look like and trying to figure out. And if you ever come across one and you're like, I don't know what this is, I don't know what I'm supposed to get from this, if you save it, the image, and email it to me, I can take a look for it and help you to figure out what kind of information you should be getting from it.
Okay, thank you.
Yeah, you're welcome. I'll be back with you guys, or with Boyce, on Thursday. So, and again, you don't have to, attend them all, but if you have any questions, you're always welcome to jump on. And I will also post these on YouTube, so you can view them later on as well.
Thanks. Have a good day.
Yep, you too. Take care.